Hello, and welcome to our presentation of HealthPoint Plus, a disruptive telehealth opportunity. What is telehealth and who's it for? We'll kind of go about that a little bit backwards. Let's look at two common problems in healthcare and see how telehealth can help them. So, the common problem number one is a sick child. The average school-aged child has about 5 or 6 colds per year. What does this mean for the family though? Well, the parents are worried, usually the mother, who then has to take time off work if it's not contentious to do so. The child has to take time off school, obviously, and if there are other children in the family, this can be heavily disruptive to them as well. They might have to be taken out of school as well for everyone to go to the doctor. First thing in the morning, if the child wakes up sick, the mother has to rush around, warm up the car, wake and pack all of the kids, take them to the sick doctor's office. It's a lot of work. Common problem number two, the part-time worker. 27 million Americans are employed part-time, 5.9 million are just unemployed. The result? They can't afford health insurance. They have no care. None. The retail and service industry jobs, where most of them are full of germs. They're stressed, they're fatigued, their immune systems are weakened. So when they get sick, and it's pretty inevitable that in that environment they will get sick, they have two options. They can either call in sick, which they can't really afford, or they have to go to work sick. This obviously just spreads sickness and germs, gets everybody else unwell, and everyone just ends up feeling hopeless and bitter. The cycle continues. The solution? Telehealth. HealthPoint Plus is a refreshing new approach to healthcare services that works with or without insurance. Healthcare is complex and confusing. Our goal is to make an easier path to diagnosis, treatment, fair drug and procedure prices, all the while creating a better experience for everyone. Our plan offers access to doctors and nurses anytime and anywhere. There are discounts on a range of specialty services such as vision and dental, as well as savings on prescription drugs. With HealthPoint Plus, it's healthcare reinvented. Some of the key features are pricing. It's so affordable. Plans start at just $15 a month for unlimited telehealth sessions. There are discounts on services, like I said, like vision and dental. It covers the whole family, with or without insurance. You have a session, a care plan can be created or reviewed, and a prescription sent. It's available 24/7 from anywhere. It's perfect for emergencies and ideal for mothers, disabled people, and the elderly. So what can telehealth actually treat? Well, it turns out quite a lot. 71% of initial non-threatening illnesses can actually be treated via telehealth. Everything that you see here can be effectively treated with telehealth. These are all fairly common complications that people would then have to take large amounts of time and money out of their day to deal with. But with telehealth, it becomes incredibly easy to get these kind of common conditions looked at. Let's look at the employer savings versus primary care. Let's say we have a business with 100 employees. That averages out to about 1,032 visits a year, 177,600 in visit fees. If just 5% of those employees went virtual, the company could save almost $8,300. That's a pretty big saving for so few employees. Going further, let's look at telehealth versus urgent care. The average cost of one non-threatening urgent care visit is $222. A year of telehealth is $120. If you have one visit, you have saved already $102. The average employee member family is 2.6 people, averages 3.6 doctor visits per year, which is a total of $2,066 per year. Using telehealth, they would save $1,958. So the employers and the employees are healthier. They no longer have to avoid care. Their whole family is included in their prescription. They don't have to call in sick and burden other employees, and they don't go into work and spread sickness. They're all happier. They have confidence to work because they have coverage. Their self-worth improves because they are provided with an employee benefit, and you have increased staff retention because they actually feel like you're caring for them. As you can see, we have a robust, nationwide network of board-certified, state-licensed physicians. We also have fairly robust monthly profit margins based on our different packages. Our consumer sales distribution plan is largely based around the idea of spending as little as we can while still achieving the biggest yields possible. One of the ways we're doing this is not blindly spending money. We're actually offering fairly generous bounties on delivered sales. That means that we can get away with spending a little bit less, but we know that we're going to get the results. This is the key to our initial consumer sales distribution plan. Spend less, yield more. Our B2B sales distribution plan is a top-down approach. As you can see, we've got benefits software, benefits brokers, and then employer groups. We don't go straight to the employer groups because there are literally thousands of them, and we would really just waste a lot of time and effort if we tried to approach all of them. So instead, we go to the top. Let's break this down a bit. Benefits software. We have a relationship with the largest self-insured software platform. Our aim is to integrate into the drop-down menu. It's paid for from RHA, HSA, and FSA funds and gives us exposure to 3.3 million lives. On top of that, it gets us speaking to 300 broker groups. Now, these broker groups are self-insured plan providers. They're not cost plus. They only charge a monthly member fee. What this means is they have no corrupt incentives to drive up price. Whether somebody needs healthcare or not, they still get the same amount of money. So they have no real reason to try and drive prices up. In fact, they've got a reason to drive prices down. They want the employer groups to go to them. They want the employer groups to be happy. They're not trying to exploit employer groups. Employer groups are happy to stay on for them, and employer groups are also happy to start referring other employer groups when they realize, hey, this is a great service, everyone's getting a good deal, I think my friend should be in on this. And that obviously now gets us to the employer groups. For example, Wendy's of Spokane wants to march us into multiple locations and sign up their employees. This is to give them some sort of a benefit to both encourage enrollment and reduce turnover, as well as provide goodwill and boost morale. We have a fuel trucking group, which wants us to speak at a 250 company trade event to try and get people set up. Trucking is great for us because there are people who have to deal with logistical problems, they're on the road, they can't always get convenient access to healthcare, so telehealth is the absolute perfect solution for these people. We're also looking at different restaurant and hotel service groups, and we will eventually be direct marketing to employer groups. We also have a unique offering, a smartwatch social fitness app. This is designed to give members back something. So this is a fitness watch, but when you wear it, activity that you do earns you health points. Health points will be able to be spent in an online marketplace for health-related things that people would be buying elsewhere anyway. Overall, HealthPoint Plus is a unique opportunity. An all-inclusive, unlimited subscription-based family plan, the smartwatch app with health points in the marketplace, large distribution opportunities already in motion, press releases to follow after the quiet period, and an industry that is about to explode and go mainstream. There is one publicly traded telehealth stock, Teladoc. They opened at $28 and have been trading, as of February 2019, in the $60 to $70 range. They don't offer monthly subscriptions, they don't offer a retail solution. You can only get it as an employee benefit, and they are inclined to have perverse incentives because it's insurance funded. Regardless, Teladoc has been trading at roughly 12 times revenue. The US healthcare market is worth $3.5 trillion US. That's close to 20% of the total GDP. The average monthly expenditure on health insurance is roughly $577 or $7,000 annually. The average deductible is $6,170. Added together, the average expenditure is $13,270 per year. This is without getting any care, as insurance is not care. These are the funds that we're seeking and what they'll be used for. There will be some slight variation in these as we start to develop, but these are very close ballparks to what will eventually be the case. Our corporate strategy: 3 months to IPO, as well as building out our unique social fitness app, 6 months to app development and benefit software integration, 9 months to distribution and PR as well as marketing, 12 months acquisitions and scaling. And these are our member and income projections over the next 3 years. Timing. Obamacare still exists. You can drop coverage and still get coverage despite a pre-existing condition. You couldn't drop coverage without having a penalty until the Trump tax plan, which is now in effect, so there's no longer a disincentive to drop coverage. The costs are now unbearable to employers and individuals, and they're wondering why they're paying for it. Simultaneously to all of this, the technology has now emerged where there's this doctor in your pocket. The technology hadn't existed, and now it does. It's going to become pervasive. At the same time, people are starting to become price sensitive and demand convenience. Customer service in healthcare is no longer going to rival that of the DMV. The timing of these 4 forces opens a perfect window of opportunity to catapult our organization. To join the rebels, contact Bob and join Dr. Convenient. That's our presentation. Hopefully you enjoyed it, and we look forward to working with you.